Hi everyone, welcome once again. Today I will be talking about the planning station for a patient with ectopic pregnancy. We have a video of the assessment. If you haven't watched the video, do watch the video and don't forget to like, to comment and to subscribe as well. And if you have watched the video, this is just a continuation. This is the planning station. Now, when you have a patient who is going for a surgical procedure in your planning station, you really have to ensure that you read your question very well, and just don't assume that because you assess the patient pre-operatively, then your plan is going to be on pre-op as well. Your planning can be pre-op planning or it could be post-op planning, so you have to ensure that you read your question paper very well. Remember, planning is a silent station and it is 40 minutes and you are expected to come up with two nursing diagnoses, two nursing problem for this patient, which you are going to plan the patient on. I'm going to talk briefly about pre-op planning for a patient with ectopic pregnancy. Now, of course, the patient is going to be in pain. So our patient's name is Janet. So I'll take my first nursing diagnosis as pain. So Janet is experiencing pain. Let's assume the pain score is 6/10 with a pain score of 6/10, period. And our aim of care is going to be to reduce Janet's level of pain to a level she can bear. Of course, each and every one of us have a different pain threshold, so we don't know what Janet's pain threshold is like, so to a level that she can bear. And for the re-evaluation date for pain, you don't want to wait until after 4 hours before you re-evaluate the patient. So to be re-evaluated today, that's the date of your exam. You can say every 3 hourly, every 2 hourly, every hourly. It all depends on how severe the pain is. Okay, so I'm going to be saying every 3 hourly or sooner if clinical condition changes. Now, the hematite part, we all know about the hematite part. And another nursing problem you can plan the patient on pre-op is safe preparation of theater. So Janet requires a safe preparation of theater. You could also plan the patient on anxiety. Janet is anxious, or Janet is experiencing anxiety due to unknown outcome of a surgical procedure. Okay, those are the three things that you can plan the patient on pre-operatively. But basically, I'm going to be talking about the planning for the patient post-operatively. All right, so now the first one I'll talk about is pain. But remember, in post-op, because you haven't assessed this patient, so you wouldn't be giving the patient a pain score. So Janet is experiencing pain, okay, due to a surgical procedure. And our aim of care is going to be to reduce Janet's level of pain to a level she can bear. Now, the re-evaluation, because it is post-op, you should try to reduce the frequency as well. Maybe make it 30 minutes or every hour. Okay, so to be re-evaluated today, every hour or sooner if clinical condition changes. And our nursing intervention, I'll be following hematite. We have a video on hematite. You can watch the video just to understand what hematite means better. But hematite is just a guide. It helps you to know what to talk about in your nursing intervention when it comes to planning. So I'll start with the first E. It means explain to Janet all her care plan and gain consent. And the next one, which is M, is monitor Janet's full set of observation. And remember, this is post-op, so you are going to be using post-op observation rule. Okay, so monitor Janet's full set of observation every 15 minutes for 1 hour, every 30 minutes for 2 hours, and then hourly for 4 hours, and then you escalate as per news policy. And the next one, which is A, you want to assess Janet's level of pain. Now, what are you going to use to assess the level of pain? Of course, we have a tool. So, assess Janet's level of pain using the pain assessment tool. And the next one is T. What do you want to teach a patient that is in pain? You could either teach the patient on deep breathing exercise, diversional therapy, or you could reposition the patient as well. All right, that depends on your scenario. So I'm going to be going for diversional therapy. All right, so teach Janet diversional therapy to ease her pain. So we've talked about the EM A, and then we'll talk about T now. So the next A is drug administration. So administer to Janet all our prescribed medication, and you want to monitor for the side effect and effectiveness of those medication. So that is the A. And then Emata, now the how. For every of your planning, for every of your nursing diagnosis or nursing problem, there must be someone you want to refer that patient to. So for pain, we are going to be refer Janet to the pain management team and the surgical team for further plan of care. Remember, she just had an operation, so you still want to refer her back to the surgical team for further plan of care. And the high stands for any instruction, anything you can educate Janet on. So instruct Janet on the use of call bell when she needs help. And the last one, which is documentation, which is very important. So document all care given to Janet. And that is the end of the first nursing problem. And don't forget to write your name, your signature, and the date as well. Now, the second nursing problem, I'm going to be going for bleeding. All right. So Janet is at risk of bleeding, or you can say Janet is at risk of hemorrhage, okay, due to the surgical procedure. And our aim of care is to prevent Janet from bleeding, okay, or you could say to reduce Janet's risk for hemorrhage. All right, so the re-evaluation date now, because this is something that is life-threatening, we don't want it to be too long before we re-evaluate our patient. So to be re-evaluated today, I'll say every 30 minutes or sooner if clinical condition changes. So now the nursing intervention for our explain to Janet all our care plan and gain consent. And for the M, monitor Janet's full set of observation every 15 minutes for 1 hour, every 30 minutes for 2 hours, and hourly for 4 hours, and then you escalate as per News 2 policy. That is for our hem. And then for the hip, how do we assess? We want to assess Janet for any sign of bleeding. Okay, this could be like monitoring the dressing, if the dressing is soaked, and then you want to check the pulse rate of the patient as well. Just you want to ask the patient if the patient is dizzy or not. So there are a lot of ways you can actually monitor the patient for any sign of bleeding. And if the patient has a chest drain, you want to monitor the volume of the output every 30 minutes, just to ensure that this patient is not bleeding. So monitor Janet for assess Janet for any signs of bleeding. That is our aim. And then the next one is T. We want to teach Janet signs of bleeding, such as soaked dressing, or it could be when she's feeling dizzy, you want to probe further what's the cause of the dizziness. Okay, so monitor teach Janet signs of bleeding, such as soaked dressing. Okay, and the next one, which is Martha, the next one is A. So administer to Janet all our prescribed medication, and you want to monitor for side effects and its effectiveness as well. And the next one is R. So this patient is bleeding. You are still going to refer that patient to the surgical team. So refer Janet to the surgical team for further plan of care. And the I, you want to instruct Janet on the use of call bell when she needs help. And the last one, which is D, is document all the care you've given to Janet. And don't forget, again, you write your name, you write your signature, and the date as well. It is simple, isn't it? Yeah. Another thing you could plan on is risks for infection. Of course, this is somebody that has just had a surgical procedure, so the patient is going to be at risk for infection. You could as well plan this patient for activity intolerance as well. Okay, so you can do other if you have any other thing that you can plan this patient on, you can drop it in the comment section. Thank you so much for watching. Hope to see you some other time, and bye for now.